Are you someone who tends to ignore symptoms when they come up? Do you try to just tough it out and hope for the best? If so, these are 10 common illnesses you should never ignore. Please like and share this video with friends and family if you find it useful. Also, please remember that this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. With that said, let's get right into it. Number 1. Tearing pain in your abdomen. A tearing pain in your abdomen could be caused by several different things, such as gas or indigestion. However, it could also be a sign of something much more serious, like a perforated ulcer, which is a hole that develops in the lining of the stomach or intestines. This can cause stomach contents to leak into the abdominal cavity, leading to severe pain and even death if left untreated. Other serious causes include appendicitis, which is inflammation of the appendix, pancreatitis, which is inflammation of the pancreas, and cholecystitis, which is inflammation of the gallbladder. If you experience a tearing pain in your abdomen, it's important to seek medical attention right away. Early diagnosis and treatment of any underlying conditions can help prevent further complications and ensure the best possible outcome. Number 2. Sudden severe headache. While most headaches are usually not serious, a sudden severe headache that comes on suddenly and is the worst headache of your life could be a sign of something more serious, such as an aneurysm or an arteriovenous malformation. An aneurysm is a bulge or ballooning in the wall of a blood vessel, which can cause the blood vessel to rupture and lead to bleeding in the brain. This can be life-threatening and requires urgent medical attention. An arteriovenous malformation, on the other hand, is a tangle of abnormal blood vessels that can put pressure on brain tissue and cause a variety of symptoms, including headaches. If left untreated, an AVM can rupture and cause bleeding in the brain, which can be fatal. Other serious causes of sudden severe headaches include cerebral venous thrombosis, which is a blood clot in a vein that drains blood from the brain, and subarachnoid hemorrhage, which is bleeding in the space between the brain and the thin tissues that cover it. It's important to note that not everyone who experiences a sudden severe headache has one of these serious conditions. However, it's always best to err on the side of caution and seek medical attention if you experience this type of headache. Early diagnosis and treatment of any underlying conditions can help prevent further complications and improve outcomes. Number 3. Chest discomfort. Chest discomfort is a common symptom that often gets ignored until it becomes unbearable. It's important to take any chest discomfort seriously, especially if it's accompanied by other symptoms such as shortness of breath, nausea, or pain radiating to the left arm. These could be signs of a heart attack, which occurs when blood flow to the heart is blocked, causing damage to the heart muscle. Heart attacks are a leading cause of death, so it's crucial to seek medical attention immediately if you experience these symptoms. Other serious causes of chest discomfort include angina, which is chest pain caused by reduced blood flow to the heart, and pericarditis, which is inflammation of the sac around the heart. If you have chest discomfort, don't hesitate to call emergency services or go to the nearest emergency room. Early treatment can make all the difference in preventing further complications and ensuring the best possible outcome. Number 4. Changes in urination. Changes in urination can be a sign of several different health issues. For men, a sudden difficulty in starting or maintaining a urine stream, as well as pain or burning during urination, could indicate prostate problems. This is particularly relevant for older men as prostate issues become more common with age. In women, changes in urination, such as increased frequency or urgency, could be signs of a urinary tract infection or other female-specific conditions. Additionally, changes in urine color or clarity might also be cause for concern. If the urine is cloudy or has a strong odor, it could be a sign of an infection. If it's dark yellow or amber, it might indicate dehydration. And if it's bloody, it could be a sign of a more serious condition. Whatever the change in urination, it's important to consult a healthcare professional to determine the underlying cause and receive appropriate treatment. Ignoring changes in urination can lead to more serious complications down the line. So it's always best to err on the side of caution and seek medical advice. Number 5, unusual vaginal discharge. Unusual vaginal discharge, especially when accompanied by other symptoms like an unpleasant odor or itching, could be a sign of a vaginal infection, such as a yeast or bacterial infection. While these infections are common and usually treatable with over-the-counter medications, it's important not to ignore them. If left untreated, vaginal infections can spread and cause more serious complications. Additionally, unusual vaginal discharge can also be a symptom of sexually transmitted infections, some of which can have serious health consequences if not addressed promptly. It's crucial to practice safe sex and use protection to reduce the risk of STIs. If you notice any unusual vaginal discharge, it's important to schedule a visit with your healthcare provider for proper diagnosis and treatment. They will ask about your symptoms and perform a pelvic exam to determine the underlying cause and recommend the appropriate course of action. Remember, ignoring vaginal discharge could lead to more serious issues down the line, so it's always best to take care of your health and seek professional help when needed. Number 6. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, is a condition that should not be ignored. It can be a sign of a more serious problem, such as gastroesophageal reflux disease, GERD, or even esophageal cancer. GERD happens when stomach acid flows back up into the esophagus, causing irritation and inflammation. This can lead to difficulty swallowing if left untreated. Esophageal cancer, on the other hand, is a rare but serious condition that can cause a blockage in the esophagus, making it difficult for food and liquids to pass through. Other potential causes of dysphagia include a hiatal hernia, which is when part of the stomach pushes upward through the hiatus in the diaphragm, and inflammation of the esophagus, which can be caused by a variety of factors, including acid reflux radiation therapy and certain medications. It's important to see a doctor if you experience difficulty swallowing, especially if it persists or gets worse over time. Early diagnosis and treatment of any underlying conditions can help prevent further complications and improve your quality of life. Number 7. Excessive fatigue. Excessive fatigue is something we've all experienced from time to time. We get tired, we rest, and then we're back to feeling great. But what happens when the fatigue persists despite getting plenty of sleep? That's when it's time to pay attention. Chronic fatigue could be a sign of something more serious going on, such as anemia, which is a condition where your blood doesn't have enough healthy red blood cells. This can make you feel tired, weak, and short of breath. It's important to get checked out if you think you might have anemia, because treatment is available and can make a big difference in how you feel. Other serious causes of chronic fatigue include thyroid disorders, such as hypothyroidism, which is when your thyroid gland doesn't make enough hormones, and hyperthyroidism, which is when it makes too many. Both conditions can cause a wide range of symptoms, including fatigue, weight gain, hair loss, and mood changes. If you're feeling fatigued, it's important not to just push through it. Take a step back, evaluate your lifestyle, and consult a doctor to rule out any underlying conditions. Taking care of yourself now can pay off in the long run. Number 8. Persistent cough. A persistent cough is a common complaint that many people have, but it's important not to ignore this symptom. A cough is usually the body's way of protecting itself from harmful irritants, but a persistent cough that just won't go away could be a sign of something more serious. Some potential causes of a persistent cough include post-nasal drip, which is when mucus drips down the back of your throat and triggers a cough reflex. Asthma, which is a condition that causes inflammation and narrowing of the airways, leading to coughing, wheezing, and difficulty breathing. And chronic obstructive pulmonary disease, COPD, which is a group of lung diseases characterized by inflammation and constriction of the airways. If you have a persistent cough, it's important to see a doctor to determine the underlying cause and get appropriate treatment. Early diagnosis and management of any underlying conditions can help prevent further complications and improve your quality of life. Number 9. Swollen legs and ankles. Swollen legs and ankles can be caused by a number of factors, such as standing for long periods of time or having a job that requires you to be on your feet all day. However, it's important to take note of this symptom if it persists, even after resting. Swelling in the legs and ankles could be a sign of a more serious condition, such as heart failure, liver disease, or kidney disease. These conditions can cause fluid to build up in the tissues of the legs and ankles. Other potential causes of leg and ankle swelling include deep vein thrombosis, which is a blood clot in a deep vein, usually in the legs, and peripheral edema, which is swelling in the tissues of the lower extremities due to a buildup of fluid. If you notice that your legs and ankles are swollen, it's important to see a doctor to determine the underlying cause and get appropriate treatment. Early diagnosis and management of any underlying conditions can help prevent further complications and improve your quality of life. Number 10. Losing balance. Losing balance, especially if it happens frequently or without warning, could be a sign of a more serious issue. It could mean that there's a problem with your inner ear, which is responsible for helping you maintain your balance. This could be due to a condition called labyrinthitis, which is inflammation of the inner ear. It could also mean that there's a problem with your nervous system, such as multiple sclerosis, Parkinson's disease, or a stroke. Other potential causes of losing balance include medications that cause dizziness as a side effect, low blood pressure, and certain heart conditions. If you experience frequent or severe episodes of losing balance, it's important to see a doctor to determine the underlying cause and get appropriate treatment. Early diagnosis and management of any underlying conditions can help prevent further complications and improve your quality of life. Thank you for watching. If you found this video helpful, please share it with friends and family. As always, I want to thank you all for your continued love and support, and I hope you stay happy and healthy.